Hi viewers, welcome to my video. இன்னைக்கு நம்ம டாபிக் காமன் கோல்ட். இந்த ரெய்னி சீசனில் நிறைய குழந்தைங்க சளி இருமல்னு வராங்க. ஸோ இன்னைக்கு நம்ம பார்க்க போகிறது how to manage your kid with common cold. ஸோ நம்ம இந்த வீடியோவில் காமன் கோல்ட்னா என்ன, சைன்ஸ் அண்ட் சிம்டம்ஸ் என்னென்ன, and how to manage them, do's and don'ts in managing common cold, இதெல்லாமே பார்க்க போகிறோம். ஸோ what is common cold? The commonest illness in childhood is common cold. ஸோ ஹாஸ்பிட்டலுக்கு சில்ட்ரன் வரக்கூடிய காமன் ரீசன் பார்த்தோம்னா காமன் கோல்ட் தான். இன் சைல்ட்ஹுட் அப் டு 8 episodes per year is normal and each episode can last 2 to 3 weeks. ஸோ அப்படி பார்த்தோன்னா ஒரு வருஷத்தில் எல்லா நாளுமே குழந்தைக்கு காஃப் ஒரு சளி ஏதோ ஒன்று இருந்துகிட்ருக்க மாதிரி இருக்கும். ஸோ திஸ் இஸ் நார்மல் unless the child is hospitalized or the child is requiring IV antibiotics. So common cold is caused by at least 100 viruses, the most common being rhinovirus. Younger children do not have adequate immunity to protect themselves against these viruses, so they can easily get infected, and with each episode the immunity develops against that particular virus. So as the child grows, the number of episodes as well as the duration decreases with development of immunity. ஸோ காமன் கோல்டில் சைன்ஸ் அண்ட் சிம்டம்ஸ் என்னென்ன? காமன் கோல்டுன்றது ஏதோ ஒரு வைரஸ்னால நம்ம நோஸ் பாதிக்கப்படுறது. ஸோ நம்ம பாடி நிறைய இம்யூனிட்டி இருக்கும். ஸோ whenever your nose is infected, the body tries to clear them by increasing the secretion. So this is noted as running nose, stuffy nose, sneezing, or sore throat, headache, postnasal drip, cough and fever. So these are the symptoms you need to recognize in your child with common cold, and also you need to differentiate whether your child has got pneumonia or it is just a common cold. So how long these symptoms can last? So as you see in this chart, a typical common cold can last as long as 2 weeks. But how do you differentiate whether it is just a cold or is it a flu? In the rainy season, flu is ரொம்ப common. Again, with the pandemic, COVID or flu or common cold, this question is there in every parent's mind. Seasonal flu na enna? It is caused by influenza virus. So compared to common cold, it is bit more severe. So fever, sometimes common cold la illam kuda irukkalam, but in flu, fever is of high grade and it is sudden in onset. Again, the patient has severe body pain, severe weakness, fatigue. Also they have chest symptoms like they have cough, chest discomfort or breathlessness, and it is one of the common cause for hospitalization in this season. Now moving on to do's and don'ts. So how do you manage your kid when they have a common cold? First and foremost, keep them adequately hydrated. Provide them adequate water or provide them some liquid diet. So this helps them to loosen the secretion, as well as when they have fever, their fluid requirement will be high. So give them adequate fluids. Second is provide them warm water or some warm liquid diet like soup. So this will soothe their throat which is inflamed. Next is any viral illness, take adequate rest. So when they take good rest, it helps them to improve fast. Then they have fever. So how do you treat fever? It is not always necessary to treat the temperature. Only if your kid is uncomfortable, try to bring down the temperature. Fever is a protective response in the kid. So the body tries to fight against the infection by causing fever. So you need to control it only when the child is uncomfortable. Paracetamol or Brufen can be utilized. Brufen, though it is used only after 6 months of age, but avoid in children who are suspected to have dengue fever. So always use only paracetamol, that too only if your child is uncomfortable. Never treat the temperature in a comfortable child. Next, saline nasal drops or saline irrigation. This is a drug which doesn't have any side effects. So this helps in removing the crusted secretions. So it helps to reduce the nasal symptoms. Next, your cough. Any child with common cold has cough, and this cough can last for 2 to 3 weeks. You need to worry when the cough is disturbing the child is not able to sleep because of cough, or the child is not able to take food because of the cough, or your child is having breathlessness. Otherwise, there is nothing to worry about the presence of cough, but the child is active, comfortable, and playing around. So, honey has been found to be useful in these kind of cough. But don't give in a child who is less than 1 year. If your child is more than 1 year, you can give half to 1 teaspoon of honey in night, either alone, or you can mix with a hot lemon water and give to the child. So far I have told you all the home remedies. So what about medicines? OTC, or cough and cold preparation. So you would have commonly heard of cough syrup or cold syrup. நிறைய தடவை அடல்ட்ஸ்க்கு கொடுத்த சிரப் இருக்கும். So can you give all these to your kid? So these are a preparation which have a combination of antihistamine, decongestants, antitussives, mucolytics, and sometimes they have even add-on paracetamol. So what does FDA say about all these? In children younger than 4 years, it's a strict no unless your doctor is specifically prescribing you. Children more than 4 years, always discuss with their doctor regarding the dose as well as safety. There are a lot of side effects or adverse events noted with these medicines because of error in dosing, as well as many kids react in a different way to the same dose of these drugs. So about these medicines, antihistamines. The first generation antihistamine is useful, especially in the first 1 or 2 days. They provide symptomatic improvement in your sneezing, running nose, but beyond that they don't provide much benefit. Antitussive, or otherwise cough suppressant. Cough reflex is actually a protective reflex. It helps to clear the secretion. So there is no need to suppress the cough unless it is causing discomfort to your kid by disturbing the sleep or preventing them from taking food, or they have obvious breathlessness for which you need to go to a hospital immediately. Expectorant or mucolytic, there is no benefit. Inhaled and oral steroids, there is no role. So now we have seen there is not much of role for many of the medicines. So the kid has running nose or nasal discharge or cough which goes on for 2 weeks. Why not try an antibiotic? So this is a common question from many parents. As we have discussed earlier, respiratory infection is caused by many viruses. Antibiotics are agents which act against bacterial infection. So say yes to antibiotics if it is a bacterial infection, and always say no to antibiotics if it is a viral infection. But can you feel better without antibiotics? So this is one of the common questions. Yes, I have told you all the steps how you can feel better without antibiotics. Also you need to protect others. So clean your hands, cover when you cough, stay home when you are sick, and get the recommended vaccines. Antibiotics are not drugs which do not have any side effects. They can cause rashes, dizziness, or nausea. Sometimes they cause secondary infections such as your yeast infection or diarrhea. So always antibiotics when it is a bacterial infection, and it's a big no for common cold. But you need to be aware of certain signs when you need to seek medical help. If your kid has trouble breathing or fast breathing, if your kid is dehydrated or has poor intake, if the kid has decreased urine output, the child doesn't pass urine at least 6 times a day, if the fever lasts longer than 4 days, and if the symptoms last more than 10 days without any improvement, symptoms such as fever or cough that improve but then return or worsen. So these are situations which require antibiotics or worsening of underlying medical condition. How do you prevent from becoming sick? Always clean your hands. Avoid close contact with people who have cold or other upper respiratory tract infection. Cover your mouth and nose when coughing or sneezing. Avoid touching your eyes, nose and mouth with unwashed hands. And before the start of the season, get annual flu vaccination shot. Thank you viewers. Stay healthy, and if you find this video useful, please share with your friends and relatives.